So today we are privileged to have with us Lisa Prasad, who is the Vice President and Chief Innovation Officer at Henry Ford Health System, and Bailey Paxton, who is an Innovation Fellow at Henry Ford Health System. And so we're going to talk about a very interesting initiative that Henry Ford Health System has embarked upon or is in the process of embarking upon. But first, I thought it'd be good to just set the table and let everyone know about Henry Ford Health System. So can you just tell us, Lisa, what Henry Ford Health System is, kind of the role and history of the organization and so forth?
Yes, I would be happy to. Thank you. And thank you, David, for inviting us to take part in your class. The Henry Ford Health System is a 100-year-old fully integrated healthcare system based in Southeast Michigan. Our flagship hospital is in Detroit. We were founded by Henry Ford himself, and we were originally founded actually to serve the workers for the Ford Motor Company when Henry Ford created his factories here. Since then, Henry Ford Hospital has become a whole system. We have a wholly owned payer, which is an insurance company. We have 6 acute care facilities, which are the hospitals in the region, and we have 200 some care sites throughout Southeast Michigan. So we like to say, if it's happening in healthcare, it's happening at the Henry Ford Health System. I can talk a lot more about it, but I think one of the really unique things as it pertains to this class is that at Henry Ford, we have the honor and privilege of serving a very diverse population. Our patients are culturally, economically, and racially diverse because so many of them do come from the city of Detroit. And so racial and economic equity is very, very important to us. Making sure that we deliver care to all of our patients, regardless of economic background, is very, very important to us. So this is why we're here talking with your class.
Yeah.
Bailey, would you like to add to that? Anything?
No, I think you did a great job. Yeah.
Well, it's interesting that this is an entrepreneurship class, and Henry Ford was the quintessential entrepreneur of the 20th century. And we're talking about a venture that's an initiative that is within a venture that he spawned, back in those days, aside from his automobile industry.
Yes. So talking about entrepreneurs, and most people don't know that the first movable hospital bed was created here at Henry Ford Hospital. The trays that move back and forth from the patient beds, that was created here. The ambulance was created by Henry Ford. And then if you fast forward, robotic surgery was basically created at Henry Ford Hospital. So this has really been the center of a lot of entrepreneurship and innovation.
Well, that's a good segue, because maybe you can tell me about your role as a VP of Innovation. What does that role entail?
So at Henry Ford, we do about $80 million of research every year. And there's a lot of inventions and intellectual property that gets created out of that. We also have a lot of really clever doctors and nurses who are always thinking of new ways of doing things. So what we do here at the Innovation Institute is we commercialize the great inventions and technologies that are coming out of the system, and we push it out into the marketplace for betterment of society. We also work very closely with early stage companies that are in healthcare, particularly around digital health, and bring them to Henry Ford to help them refine their product, to help them introduce their product within a healthcare setting, to help them navigate how to sell into a healthcare environment, often to become their first customer, and then jointly launch the product into the marketplace. So we commercialize our own technologies, and we work with early stage companies that are promising to provide better care for our patients.
That's great. Well, it's an impressive organization. I visited there once and saw some of the 3D printed organs and all that kind of thing. And
Yeah.
it's pretty fascinating. So I like to think of the class and the people who work with the class, the entrepreneurs, the students, the former students, as a community. And so I'd like to start these interviews with you just telling us, each of you, something about your personal background and your professional background, and how you came to this point. So
okay, I'm going to let Bailey start on that one.
Sure, I was going to suggest Bailey go first.
Oh boy.
Good.
Where do I start? So I guess one fun thing is I've been living on a sailboat all summer in Detroit. It's like a fun thing, but
where is it docked?
At the Detroit Yacht Club.
Oh, okay, out on Belle Isle.
Yeah. So in the middle of the Detroit River, you would think of Detroit as like a particularly water-filled city, but it is great for sailing. So that's been a blast. But yeah, so I graduated from Michigan State in December of 2019. But during my time there, I started a digital health company called Agile Care Solutions. And so I ran that for 2.5 years. We raised institutional funding, but unfortunately we had to shut it down last summer. And so that was right before I joined the team here at Henry Ford, but it's made an excellent transition and a great fit. So
where are you from originally?
I live in Brighton.
Okay. Kensington Park.
Yeah. Yes, sir.
Etc. Okay. And Lisa?
So being considerably more mature than my friend Bailey, I have a longer background.
You can give us the abridged version if you want to.
Yes, I will give you the abridged version. So I think the question was, how did I find my way to being in the innovation world here in Detroit? And it really is.
From, first of all,
where am I from? Yeah. I was born in India. So I'm an immigrant, although I came here at a fairly early age. I came to the US when I was 10, and I grew up in Bloomfield Hills, and then lived outside of Philadelphia for 20-some years, and then moved back to Detroit in 2013. So I'm from here. I am a big believer in large institutions such as universities and hospitals and their ability to impact the economic health of the communities in which they live. I'm passionate about tech-based economic development. I'm passionate about creating population health. My background is in working in both the private and public sectors. I started my career at PricewaterhouseCoopers in New York City in the higher education consulting practice. I have worked at the University of Pennsylvania. I've worked here at the Henry Ford Health System. I had my own business where I raised a venture fund of $30 million and deployed it to develop real estate around universities. So I've sort of crisscrossed between public and private sectors, but the underlying base of my entire career has been, how do you take the incredibly rich assets that live within institutions and leverage them to create new businesses and to really uplift the communities that surround them.
Well, that's a great segue too, because that's what this initiative is all about. So maybe you guys could take a minute and talk to me about the problem you're trying to solve here and who you're trying to solve it for.
So I will talk a little bit about that, but I think that as soon as I talk for about 2 minutes, everybody just immediately grasps it, right? So the problem that we're trying to solve is, as healthcare moves toward a greater reliance on digital technologies and digital connectivity, how do you not leave behind a great percentage of the population that is not natively using these technologies? So being in Detroit, we have a lot of people who are older, who are economically unable to have adequate resources for broadband and for smartphones in some cases, and other digital technologies that would connect them to a healthcare provider such as ourselves. So when they lack this connectivity and when they lack this digital inclusion, what happens is that the population suffers. And people always calculate the cost of providing healthcare, but nobody ever calculates the cost of not providing healthcare, right? So what is the cost of leaving behind such a big chunk of your population who can't access your services? It's huge. If you are sick, if your community is sick, that means people can't find jobs. That means people can't support their families. That means people can't see doctors. So they end up in emergency rooms. That means that often leads to bankruptcy. It just has a downward spiraling effect. So the problem we're trying to solve is, how do we make digital health more inclusive for our community? How do we really create much more digital inclusion in communities such as Detroit?
Okay. And I want to just jump back for a minute because Bailey, you indicated that you started some kind of a digital health venture. And was that related at all to this, or what was that?
No, I was focused more on family caregiving. So if you're taking care of your mom and dad.
Okay. Yeah. Yeah. And so, in terms of the need that's felt and the problem that exists, the cost, there's a cost to the individual that's not served, right? But there's also a cost to the institution, to the hospital. Can you indicate, what those costs are on each side?
Well, what I can tell you is that the Henry Ford Health System provided, I think the most recent year in 2019, $400 million of uncompensated care. So that means we provided $400 million of care to people who couldn't afford to pay for it. Mm-hmm. Now, that's just a part of what we do. It's a big chunk. It's a big, big chunk. And that's part of what we do. Yeah. We do it. So the question is, could we have preserved wellness by taking care of some of these patients before they actually had to come here? Mm-hmm. So did they wait too long and get too sick so that by the time they made it here, they had to spend a week in the hospital, right? So there is a cost. And I'm sure that economists have sort of figured that out.
Yeah.
But cutting the cost cutting the cost to the hospital is only one of several missions that we have. Of course, everybody wants to save money, and let's be fair, if we're not for profit. So it's not like if you save money, somebody gets rich. We don't. We just spend it on, building new ICUs for other patients. So we want to save costs, but we also want to better the health of the community. Yeah. And we see that as our mission.
So you want to get people on this digital health platform. You want to get more of the community on this digital health platform. Tell me about the platform. What does that look like?
So initially, we're just trying to get people signed up on our EMR. And again, I think this is where the private sector can come in and be maybe more creative. But right now, our first step has been, if I'm going back, I'm a patient of Henry Ford. If I get sick, or this weekend, my son was sick and it was the weekend. So what did we do? We went onto our mobile app, we clicked on there, and within 20 minutes, he was having a video visit with a doctor at Henry Ford at 10:30 at night, who prescribed medication that we were able to go get for him the next day, and off he went. Now, that is a service that lots of people should be taking advantage of, particularly in our community. So the first step of doing that is, how can we tell people about it, and how can we get people signed up for My Chart, which is what we call this platform.
Yeah.
So that's what we're trying to do as a first step. We totally understand that that's only a first step, and it takes a lot more than that. But
yeah,
that's
so
the
when you
first
say
step.
EMR, just for students who don't know, the electronic medical record, right?
Yeah. Thank you.
Okay. And so, so let's say I'm a person in Detroit who's out there in the community, and I'm not on this platform, but I want to get it. How do I get it? How do I go about getting on the platform?
Yeah. So you can come in and see us, you can call us, you can contact us in a variety of ways, and you can get on it. But what we're trying to do is go out into the community, and we're using faith-based institutions as our hubs. So we think that the faith-based institutions, the large churches which are in Detroit, have a very unique relationship with their parishioners. They're trusted institutions. And we want to partner with them so that they can talk about maintaining wellness, maintaining health, the value that comes from having access to doctors and nurses 24/7. If they can talk to their parishioners and sort of help them to understand the value that comes from this, we will be there to sign people up who are interested. So that's sort of the model that we've been following. Now, again, I don't know if it's the right model, but we're an innovation. So we begin somewhere, and we always our mantra is, okay, let's just try something and learn from it. And if it doesn't work, then we're going to switch. We're going to pivot. We're going to, slowly emerge into a model that does work. So right now where we are is, let's partner with these churches and let's introduce ourselves to this community and the value that's added from being part of this digital platform, and see if we can get people signed up to take advantage of this.
And what would be the demographics of this target community that you're reaching through the churches? I imagine they're older in most cases, but how would you define the target market for this? By and large,
they're Detroit residents. So we're only in Detroit, in the city of Detroit. By and large, they're Black, almost exclusively. I would say that we have a lot of families out there who are living in our catchment areas that can benefit from this. So I wouldn't say they're a majority older. It's a pretty good mix. Mm. I have one of our team members who couldn't join us today is sort of our partner who actually does the outreach, and she's very embedded in this community. So she has a lot better demographic information for you, which we'll be happy to share in class. Yeah. I believe she's joining us next week.
Okay. And so are there other channels by which you're trying to reach these people, maybe social media or any other kind of means of approaching this audience?
The social media is out there all the time. Henry Ford has its own Twitter and Facebook and all that stuff. And we're always out there. There's a lot of research that's being done in partnership with community organizations. But right now, this is the channel that we're using to see if we can get people signed up for more digital access to our services.
Are most of these people covered by some health plan or like Medicare or Medicaid, or are they generally eligible for these kinds of healthcare assistance plans? I'm surprised when you say a number like 400 million uncompensated care. I'm just wondering was there a certain percentage of those people, if they had been signed up for something, in advance, maybe that number would have been less. But
we have a whole office here who does just that. When a person comes in without insurance, they are working with them to see if they're eligible to sign up for any assistance, any public assistance. So we do offer that as a service when they show up.
Yeah. So that 400 million is after all of that.
Mm-hmm. Mm-hmm.
Wow.
My son actually volunteered last summer or 2 summers ago in that office. And so it was an amazing experience for people who don't normally see how challenging it is for somebody who walks in the door without insurance and has to take advantage of, and they're really, really sick, and they know that they don't have the means to pay for it. And it's sad. It's just sad.
Be terrifying for them.
It's
too.
Terrifying. Yeah.
So tell me how this tell me how this initiative is going to work. Kind of walk me through it.
Well, we're trying to figure that out as we build the program, which is what innovation is. What we think is going to happen is that we will partner with some large churches and work with them to create these. I don't want to say health fairs, because health fairs are sort of overdone and that's not what we're about. But we want to create these healthcare hubs inside churches that connect us to the parishioners. Mm-hmm. So what does that mean? That means maybe once a month or once every other month, we have 3 people after the service who are there to just sign people up and help them figure out, how do you access my chart? And if you're sick, how do you actually use this app to get a doctor's appointment within 20 minutes? So that's one thing that we hope to do. After that, I think it's, we'll have to measure our success and see what the next phase of it looks like. But right now, we're just focused on, how do you identify people who want to take advantage and who we can urge to take advantage.
Mm-hmm. So who's on the team for this initiative, and what are the different team members going to be doing?
It's a very broad team, which goes beyond innovations. We have the head of our community outreach is Dr. Kimberly Dawn Wisdom, and she has supported this. She actually sends community nurses out with us, so that when we're having these interactions, if somebody wants to see a nurse, they can see a nurse right there. We have a couple of doctors who are interested, and they will probably show up to offer medical advice should somebody need it. We have our IT group that's engaged, because wherever we go, we need access to Wi-Fi. So they go and make sure that we have internet access, so we can actually sign people up. So it's a variety of people who are coming to, and then of course innovations. So we have myself, we have Bailey, we have Wilma, we have another team member, Vikas. So we go and we coordinate and we make a pitch, and hopefully we're successful.
To the religious institute or to the church? When you say you make a
pitch? Yeah, so Wilma, who you will meet next week, she is very connected to the reverends around here and the larger churches. She's very integrated into the faith-based community, and she's sort of the community. So there's a level of trust that's already built between Wilma and this group.
Yeah. So Bailey,
which is very important. I mean, I guess definitely. I don't know. Well, we should talk about that.
Trusted messengers is very important. Bailey, what are you going to be doing with this team?
That's a great question. I'm just very new to this project. So whatever's needed.
Well, it's good that, I think the students will be excited about being on the ground floor of this thing and seeing how it grows from here. So you're going to be going out to these institutions and through them signing people up for the platform, right? So how do you see this? Let's say that you're very successful with this and you get a lot of people signed up. What next? Where do you go from there?
The biggest problem one of the biggest challenges is that people sign up and then they forget how to use it, right? How many passwords have you signed up for in, regular course of life in the last 2 years? And you lose your password and you never go back to that site and, it's done. So one of the challenges for us will be, once we sign people up, how do we really stay in front of them? And how do we keep reminding them, either through these events or through some other mechanism, that we're here and please take advantage of the services that are to be offered? That's something that we will need to, focus on next, I think, after we figure out how to get people signed up.
Yeah. So after being signed up, how are some of the ways that they would use the platform? I mean, obviously, if they're feeling sick, they want to access somebody. But what are the different tools that are made available to people through this digital health platform?
You can make appointments when you're sick, but you can also monitor your health through this platform. So it'll always tell you, if you have a baseline, what your blood pressure was during your last check, what your heart rate was, etc. It can also integrate with Apple Health and your Apple Watch if you're sort of inclined to have those kinds of tools. I don't know how many people will. Yeah. But there are ways to maintain your wellness using the data that's there. But we need to be careful to make sure that we don't, sort of offer services that are too sophisticated. Right now, we're just trying to get people to, take advantage of video visits and when they're sick but there are lots of tools should people desire more sophisticated level of self-management of their health. Yeah.
So again, thinking of this initiative as a little business, there are revenues associated with getting people signed up for these different services and things, and for insurance and Medicare and Medicaid. But on the other hand, there are costs to implementing this initiative. Specifically thinking about the initiative, you have a team, and that you have to pay the team, and you have these partnerships. I don't know what the relationship is with you and the partners, but can you just indicate what doing this initiative costs Henry Ford Health System? Not in terms of dollars, but just qualitatively.
What it costs. So I would say that I have Wilma, who's sort of half-time dedicated to this initiative. So that's 0.5 FTE. Me, Bailey, some of the other people, through innovations, we're another 0.5 probably. So that's one full body. And then which is engaged in the planning. When you do the execution and actually it's time to go to the churches, then you have a lot of people, but it's not, so then you might have 2 nurses, right, who have to show up for 3 hours. You might have 3 tech people who have to show up for 3 hours, but that's once a month. So I think when you add it all up, the cost is not that great. Mm-hmm. Mm-hmm. But hopefully that gives you some sense. And it's not in the grand scheme of things. Yeah, it's not that great.
Compared but I can see how. Million.
Yeah, but I can see how if you're a business and you're doing this, on a shoestring with 2 or 3 people.
Yeah.
It would be complicated.
Yeah. Now, clearly, the churches are a key partner in this whole initiative. Are there other partners that help make this thing work?
Right now, we're focused on the churches, but it would be really interesting as a business model to see who else is out there. Can corporations play a role with their employees? I don't know. That's something that I've thought about, but we've never gone there. Can we partner more with the city? I don't know. Are there other not-for-profits that we can partner with? All these are great questions. Yep. Okay. Yeah, we think that's where the most trust is, actually. Yeah. And the one thing that we've learned during this whole COVID vaccination crisis, and I do think that it's been a crisis for us because so many people are continue to be unvaccinated. Yeah. There's a lack of trust in healthcare institutions, unfortunately, and that's reflected in people's reticence to come forth and get their vaccine. So that's been a big eye opener for me in particular.
Yeah. So that gives me a really good picture of your initiative and thinking in terms of where things might go. Again, if there were going to be some independent organization doing this kind of thing, if there was an entity out there, some business startup that was intimately connected to the community, and their role was to connect people who need service to those service providers, right? Not only you, but to other providers of services, vision services, dental services, whatever. Would you entertain, using the services of an organization like that? That would be
Sure.
maybe outside of Henry Ford?
Yeah, we have lots of service providers who we work with, and there's no reason why we wouldn't entertain another one if we had faith that would positively impact not just the hospital but the community as well.
Yeah. And so I guess the last area I want to touch on is, I think I understand how you plan to go out there and get people signed up on the platform. Have you thought about what you will do, following that to kind of maintain and build the relationship with this community and, kind of keep that solid connection with those people you sign up?
Yeah, that is the next thing that we need. That's the next phase that we need to really work on.
How many people do you suppose are out there who could, who need service but aren't getting it?
Lots.
Yeah.
I don't have a number.
I mean,
but we
Detroit
just know anecdotally.
600 some odd thousand people total. Do you have an idea of what the unserved population is out there?
I do not. I just know that it's a big number. I would not put a number out there because, quite frankly, I don't know if somebody is going to DMC. I don't know if, a lot of this population, when they get really sick, they'll come to Henry Ford. Next time they'll go to the emergency room at DMC. The next time they'll go to the emergency room at St. John. So it's hard to even define what the population is.
Yeah.
That can benefit.
So in terms of the health system providers in Detroit, Henry Ford is the largest, or what's the market share for each of these providers?
We're all regional now, so it's hard to say, which is the biggest. But the biggest in the state of Michigan is now Beaumont and Spectrum through their merger. So they're definitely bigger than Henry Ford. Yeah. Michigan Medicine is bigger than Henry Ford. So we're not the biggest, but I do think that within the city of Detroit, we are just an old, venerable institution that a lot of the community is attracted to.
Yeah, I think this is a really interesting endeavor that you all have going here. And again, I look forward to seeing what kinds of innovative ideas the students can come up with, and look forward to you all coming out to the class and presenting this to the students.